The Social Security Amendment Act 2013 is a bill that marks a defining moment for the Second House of Assembly and the people of the Virgin Islands, says Health Minister Ronnie Skelton. After legislators discussed the bill clause by clause during the committee stage, the House passed the bill with amendments. The Health Minister says the NHI is likely to begin rolling out sometime around October this year. Sean Rose has more.
Health and Social Development Minister Honorable Ronnie Skelton piloted the Social Security Amendment Act 2014 when the fifth sitting of the House of Assembly, which began in March, continued on April 8, as legislators moved apace with efforts to further advance health reform in the Virgin Islands.
I am extremely pleased to present to this Honorable House a bill that will no doubt be recorded in history as a defining moment for the Second House of Assembly and for the people of these Virgin Islands. The Social Security Amendment Bill presents a mechanism for universal health coverage, an opportunity to steer our health system in a new direction towards greater efficiency, improved quality, and financial sustainability.
Leading the debate on the bill, Skelton said the National Health Insurance Plan involved the most extensive public consultative campaign drive around the territory.
That the proposed National Health Insurance System has had the widest public consultation of any initiative in the recent history of this territory. During the past year and a half, the NHI implementation team, under the direction of the Social Security Board, has held numerous public meetings and consulted with a cross-section of stakeholders. The team has also taken the education process to every radio station, the online news sites, newspapers, and television.
However, opposition member for the 3rd District, Honorable Julian Fraser, is of the view that public consultations on the proposed NHI should have continued to allow for more questions and concerns to be answered and clarified.
Madam Speaker, I submit to you that those questions to this day remain unanswered. At least to me, one of the persons who attended the meeting expressed my support for the program with reservations, substantial reservations. I think that the minister and the ministry owe it to the people of this territory to explain in details and in no uncertain terms how this program is expected to function.
Deputy Premier Dr. Kedrick Pickering recalled the historical challenges for healthcare in the BVI and noted the achievements to date as government endeavors to advance healthcare for the benefit of current and future generations.
I remember only too well between 1992, Madam Speaker, and 1997, Dr. Smith and I were the only two people working in the hospital who could do any kind of surgery. This is a country where we have short memories and we tend to forget. Only two of us. I met him there working, and there were times when he was the only person available in the country who could do any kind of surgery. Our memories tend to be short. I listened to the arguments about national health insurance, Madam Speaker. I listened to the arguments, and there are people who have good insurance, and they're upset, and they want to cripple and criticize and destroy those of us who are trying to help the system because we're taking something away from them. But there was a time when we didn't have it, Madam Speaker.
During the November 19, 2013 sitting of the House of Assembly, Minister Skelton had moved the motion for the introduction and first reading of the bill entitled Social Security Amendment Act 2013 to allow for the separation of the administration of the NHI from the Social Security Board. Under the National Health Insurance Plan, employees will contribute 3.75% of their salary, while employers will contribute 3.75% as well. The benefits of the NHI include access to quality health care for life for all residents, regardless of their ability to pay, emergency health care coverage anywhere in the world, and an overseas network of quality health care providers for the services not available in the BVI, among others. In his statement while wrapping up the debate, the Health Minister said local private health care providers are making the necessary changes to facilitate the introduction of the universal health care system under the NHI. The NHI is expected to pay for the high cost of healthcare, allow the BVI Health Services Authority to maintain and upgrade healthcare facilities throughout the BVI, as well as hire qualified and experienced doctors and nurses to improve the overall quality of healthcare services. These services include primary care and specialist visits, hospital room and board, surgery, casualty and emergency care, pharmaceutical services, mental health care, dental care, eye care, and approved prosthetic devices. Sean Rose, JTV News.